So quickly we'll be looking at 10 weird changes that occur in pregnancy. The 10th one is very important.
I will advise you to keep quiet.
The reason why this is important is so that when they start happening, you won't be surprised, because most of these changes revert back after pregnancy. So let's go there.
Let's have it. Let's have it.
Change is excessive vomiting. Pregnancy comes with nausea and vomiting because of the hormonal changes. But sometimes the vomiting can be so excessive. It's called hyperemesis gravidarum. It can be so excessive to the point that it may require hospital admission. So when you vomit once or twice, you may not want to panic. But when it becomes excessive, please run to the hospital so that you can get stabilized. It can actually be detrimental if nothing is done. And this mostly happens in your early first trimester. After that, you are fine. The second change is weight gain. You can actually go from this to this during pregnancy. It becomes very important for you to watch your weight while pregnant, because it's easier for you to watch your weight than trying to revert back to your previous weight after pregnancy.
Thank you.
The next change is called pica. During pregnancy, some women may start having the urge to eat things that are not edible, things like chalk or even sand. Some women may start having this urge to eat things that naturally they wouldn't have eaten. So my advice to pregnant women is, please try to control the cravings, especially when you're having the urge to eat things that are not healthy. Please, I know it may be difficult, but please try and control it. After 9 months, you'll be fine. The next change is frequent urination, especially in your late pregnancy. The reason is because the head of the child puts pressure on your bladder, so it causes constant irritation. You always feel like passing urine, but when you go to the restroom, you discover that you pass little or no urine. It can be discomforting, but please endure it. After 9 months, you will be fine. The fifth change is pain, tingling and numbness in your wrist and hand. It's actually called carpal tunnel syndrome. The reason why it happens is because there is fluid retention on your wrist, putting pressure on a nerve there called the median nerve. The pain can be very severe sometimes. If it is severe, you may want to talk to your doctor about it. Or if it is mild and moderate, you may want to endure. Once you put to bed, you are fine. The next one is gingival swelling, swelling of the gum. This happens because of hormonal changes and increased blood supply to the gum. Sometimes it can even bleed. The look is not always wonderful, but that is one of the prizes for motherhood. So please endure. After 9 months, you will be fine. Another common weird change that occurs during pregnancy is heartburn. Doctor, I'm having heartburn. I'm having chest discomfort. Most women always complain, and it usually happens in your late pregnancy. You feel this chest discomfort, heartburn, or sometimes when you are done eating, it feels as if the food is coming up. The reason is because the growing uterus puts pressure on your abdomen so that the content of the stomach may come up. As usual, after pregnancy you'll be fine, so please endure. If the symptoms become persistent, you may want to speak to your doctor about it. The eighth change is also common, bilateral leg swelling. Your legs can actually move from this to this during pregnancy. It's not an issue. When it happens, speak to your doctor about it. You may want to do 1 or 2 investigations to ensure that what is causing the leg swelling is not something serious, like preeclampsia. So once preeclampsia and other conditions are ruled out, you are fine. Once you are done giving birth, your legs go back to normal. The next change is called hemorrhoid, what some of you call PIE. Some of you may start noticing those engorged veins in your anus. It can be painful, especially in your late pregnancy. It occurs because the growing fetus can put pressure on your rectum. And also, pregnancy is a risk factor for constipation, which can cause hemorrhoid. The symptoms can range from mild to severe. If it becomes severe, speak to your doctor about it. There is something that can be done. Finally, the 10th change is called varicose vein. This is not a common occurrence, but when it does occur, it can be very serious. And it usually happens on the legs and feet, and sometimes even on your private parts. It can actually be very painful. So when you see it, do not panic. Speak to your doctor about it. He can recommend 1 or 2 things to help you. If the pain is serious, he will give you something for the pain. But please, try and endure. Once you are done giving birth, after a few weeks, it resolves spontaneously. So if you've listened to this point, you have 1 assignment. That 1 assignment is for you to like, follow, and share. Thank you.